So I think it's a really amazing opportunity. It's really nice to be able to highlight what we are doing here in Windom and all the positive things that Windom Area Health and the community bring together for the people of the region.
It's a wonderful opportunity to show what we have to offer. Windom Area Health has been growing and expanding quicker than we can keep up with sometimes, but somehow we're just managing to do it, and it's great to be able to showcase that to the community and the public.
So I think there are so many ways that Windom Area Health really shows that it is connected and responsive to our community.
It's not your typical small town hospital.
You're taking care of your home, you're taking care of your family, you're taking care of your friends.
The community supports us, so that makes it easy to be able to support and provide care for them.
This is your community, and that shows every day. We can keep the health care that we need for ourselves and our families, that we need for our communities, but we have to work together to do it, and we really can do it if we do work together.
Healthcare organizations throughout the United States are struggling to stay afloat as expenses continue to grow and insurance reimbursement decreases. In rural areas, patients and providers face unique challenges when confronting the ever-changing landscape of the healthcare industry.
There is a whole gamut of reasons why healthcare organizations in the United States are struggling right now. So between increases in pharmaceuticals, increases in our equipment that we need to invest in to continue to keep healthcare systems modern and to keep us functioning efficiently, we're seeing increases in those expenditures. A significant challenge that rural facilities face is the trust that your community has in not only the quality of care that they may receive, but also just to make sure that they trust that their health care is confidential.
In rural areas, hospitals do tend to be a community hub and kind of the backbone of a community. And when a hospital is able to maintain its independent status, to be responsive to the needs of the community and responsible for the healthcare of that community, it really adds a dimension and a voice that is very difficult to obtain in a larger system. Overall, our populations are aging. They are needing more healthcare, and during that process, it frequently is more difficult for those populations to travel.
Windom Area Health is committed to ensuring the southwest region of Minnesota has access to innovative medical care. They provide state-of-the-art facilities and equipment for the population of 8 counties within southwest Minnesota.
This community almost lost their hospital. The community came together and had a fierce fight to keep this hospital alive, and they did accomplish that. Windom Area Health's vision is to continue to be that beacon of hope for our communities. We've been able to recruit top talent for clinical staff. We are going to be the answer and a selection to other communities who are losing their healthcare systems.
I have been working at different small to medium-sized rural hospitals for the last 10 years. The fact that this facility is loud and proud and owned by this community and responsible to this community and really listens to the needs of the community was a huge draw for me.
The impact you're going to make as a rural physician can be significant. You have the ability to make palpable difference in the lives of your patients and the community as a whole. So the main goal we have is to provide high quality, evidence-based care to our patients in a timely and efficient manner.
As healthcare systems pull out of these smaller communities, we are also reaching out to our other independent critical access hospital partners to look at how can we collaborate? How can we work together? What are our strengths that each facility can offer? And how can we share those costs so that we can make a difference for these communities who are losing their health care? Another significant strategy is working with our city leaders, working with other large employers within our community, and getting to understand what their vision is, because their vision may be very impactful to our vision.
The biggest thing for me that really shines through when we're talking about bringing in healthcare providers and bringing in staff is the obvious focus on removing barriers between patients and the healthcare that they need to receive. Every time that we meet and we talk about where we're going, what we need to do next, it really does focus on what's standing in the way of patients getting what they need, what can we do about fixing that? And the answer is never, no, that's just too hard, we can't do that. It's always, how can we fix that and how can we make this better? That's not an attitude you get everywhere, and I do absolutely love that it obviously comes through in every interaction that we have here.
I'm very optimistic about the future. I'm fascinated by integration of artificial intelligence in medicine. The advancement in medical technology is looking bright. Hopefully we'll have better point-of-care diagnostics that can help us with our decision-making in the future.
Our home is on the Lakeshore Drive at Mountain Lake. It's about 12 miles from our house to Windom Area Health. And we have used cardiology here, ophthalmology. I had cataract surgery. My wife has used orthopedic surgery here, and she has had both of her knees replaced with very good outcomes. I've been very pleased to have these specialty care services available close to our home.
Windom Area Health is more than just a critical access hospital. They are a regional center of care, utilizing state-of-the-art technologies by a talented and experienced medical team. Because strong communities start with strong healthcare. Learn more at windomareahealth.org.